everyone, this is Dr. Mimi Tan. Welcome to this live virtual seminar. This is about bariatric surgery and weight loss treatment options. Welcome to tonight's seminar. This seminar takes about 20 or so minutes just in terms of all the different things that we'll talk about and go over. And then the last portion of this seminar will go over different questions that people have. And so if you do have any specific questions about anything that we talked about that come up through the course of this talk, feel free to send us a question and I'll answer them. Either type them directly into the YouTube chat below, or you can feel free to text us at this number here, and that'll come to us and I'll be able to answer those questions as well. All right, so let's get started. I like to start these seminars with a fairly simple seeming question, and that is weight loss hard? And it might seem like a little bit of a silly question for these seminars, for the purposes of these seminars, but I think it's actually a critically important question. And I think it's critically important because we as a society have actually answered this question incorrectly. What we have said over and over and over is that actually weight loss isn't that hard. All you need to do is try a little bit harder, maybe eat a little bit less, exercise a little bit more, and you should be able to lose weight, no problem. And yes, we've heard that all over and over and over again. And if you are here today, I really want to congratulate you and applaud you because you have heard that so many times, but at some point you've said, no, actually, weight loss is incredibly, incredibly hard. What more can I do to help myself and make weight loss a little bit more manageable? And that is what we're going to talk about today. Right. And you are correct if you say that weight loss is incredibly hard. And I like to have data, I like to have numbers, and this is the graph that shows that yes, weight loss is incredibly hard. This graph is from the CDC, and each of these lines actually represents a BMI group. And for those of you who are unfamiliar, BMI is a ratio of your height to your weight. And based off of your BMI, we kind of push you into either a healthy weight, overweight, or an obese category. And there's a lot of different criticisms that you can make of BMI. It's certainly not a perfect measure. That said, it is kind of the best thing that we have to kind of categorize people based off of their weight and height. Um, and so what we see in each of these lines is a couple of different things. There's two things that I want to highlight. One is that obesity rates have actually been steadily climbing over the last 60 years. That's the green line here. And then as of 2017, in the US, more than 40% of the adult US population sits in that kind of obese category, and more than 30% of the US population sits in the overweight category. And again, we can make some, BMI is not perfect, like I said, but what this tells me is that most Americans are struggling with their weight to some degree. And this graph only exists because weight loss is incredibly, incredibly hard. This graph simply would not exist. This green line would not exist if weight loss was just as easy as we thought it was. All right. And so why is weight loss so hard? And that's the million-dollar question. And part of why weight loss is so hard is because there are so many things that go into how much someone weighs and how hard it is for someone to lose weight. There are a lot of different factors, some of which you do have some control over, right? You have some control over what your diet is. You have some control over how much you exercise. But one of the really big things that we do not have easy control over is going to be your biology, who your parents are, what your body chemistry is, what your hormone balance is. That is something that you have, and there's no easy way for you to manipulate that or make that more amenable to you losing weight. And that is going to be a huge chunk that factors into, again, how hard it is for someone to lose weight. So, a common story that I hear from my patients when I first meet them is that I have tried so many different ways to lose weight. I've tried every diet under the sun. And maybe, yes, I've lost X number of pounds with some of these diets, but I haven't been able to keep that weight off. And it is so, it's so difficult because people have tried everything and there's so much like guilt and shame that goes into that. And what I would tell people is that weight loss failure is not a moral failure. It's not because you didn't try hard enough. It's not because you didn't work hard enough, or that you're lazy or whatever. It's a failure against your biology. It's a failure against all those different things that we talked about that you don't have control over, that has made losing weight a crazy uphill battle that is sometimes impossible to climb, right? And so that's why we're here today. How can we make that crazy uphill battle into something that's more approachable, something that's more doable? And this is what I call your weight loss toolkit. These are the different tools that we have available when it comes to losing weight. And we'll talk about each of these in a little bit more detail here. So the first one is going to be diet and exercise. And as you can probably guess, this is your least effective singular tool for weight loss. Diet and exercise, when used alone, is going to be fairly, I would say, ineffective. On average, I estimate that people can lose about 5% of their total body weight with just diet and exercise alone. So if you currently weigh 200 pounds, with diet and exercise, you can expect to lose on average, again, around 10 pounds. Once you're above a certain BMI threshold, it is incredibly, incredibly hard for you to go from that BMI to a normal BMI or a lower BMI threshold. Success in that situation is really going to be the exception and not the rule by any means. That said, I don't want to knock diet and exercise too hard, because diet and exercise, and diet in particular, is going to be an absolutely foundational tool for any of these other different tools that we're going to talk about later. And what I mean by that is that everything that we're going to talk about later, medicine, surgery, these are things that are going to help you lose weight, but they are not going to work if you are not eating the right things, if your lifestyle is not amenable to losing weight, if you're not eating the right things, if you're not eating healthy, those tools are not going to work for you. And so diet is going to really be the foundation that is going to make you successful long term. And so I really can't overemphasize that enough. This is our other tool that we're going to talk about, and this is medications. Medications, this is kind of a popular topic right now, or a hot topic right now. There's been a lot in the news about some of these newer weight loss medications, and in social media, and so we'll spend a little bit of time talking about this. So medications, broadly speaking, I categorize into two types. One is going to be non-injectable medications. These are medications that come in a pill form and you take by mouth. Okay, and you usually take one of these pills every single day. The other category is going to be injectable medications. These kind of come in a syringe and you inject them usually into your leg once a week. The non-injectable medications, so the pill or capsule forms of medications, those we've actually for the most part have had for a while. And these medications are going to be a little bit more effective than weight loss with just diet and exercise alone. On average, I estimate, again, around a 5 to 10% weight loss with some of these medications. Now, these newer injectable medications, these are medications like Ozempic and Wegovy, or the newer ones that are tirzepatide. These medications are going to work in a couple of different ways, and they are a little bit more effective than the pill forms that we talked about earlier. They're going to give you about 10 to maybe 20%, actually as high as 20% weight loss with, again, these injectable meds. Now, these medications, broadly speaking, are going to work in two different ways. The pill forms are going to work on your brain, and they're going to just kind of help decrease your appetite. They kind of turn down some of the food noise around you and make it a little bit easier for you to eat in a way that is healthy and eat the right things. The injectable medications are both going to work on your brain. They're also going to work on your stomach, and they're going to slow how quickly food is able to move through your stomach so that food is going to stay in your stomach for a longer period of time. So it allows you to feel fuller faster, and it's going to allow you to feel fuller for a longer period of time as well. Um, and I would say some of the good things about medications is that we do have different options, right? We have the non-injectable medications, we have a couple different injectable medications. And so when we start you on medications, we certainly have some different things that we can try and see what works with you. One of the downsides with medications is a lot of these medications do have certain side effects, and some patients don't have side effects with some of these medications, and some of these medications, they do have severe side effects. So again, it's a matter of kind of figuring out what works best for you. Currently, and this applies mostly to the injectable medications, where it's often it's insurances often will not cover some of these medications for the purposes of weight loss. And so if you are in that category where your insurance doesn't cover one of these medications, it can be prohibitively expensive to pay for out of pocket. So that is one of the downsides of medications currently. It's also can be very, very difficult to get a hold of these medications right now because there's been so much popularity. So many people want to be on these medications. That I think will improve over time. Now, one other common question that I'll get from people is, what is the long-term durability of these medications? Do I have to take these medications for the rest of my life? And that's an important question. And I think the way that we have to frame obesity moving forward is that obesity is a chronic disease. It is something that if you have obesity, you're going to have to continue to work at it for the rest of your life. It's like high blood pressure or diabetes. And with these medications, the idea is that if you are taking these medications and you stop taking these medications, like high blood pressure or like diabetes, oftentimes that is going to come back. The weight is going to come back. And so what we know with these medications is that most patients are going to regain weight once they stop taking that medication. Now, it's not the rule. There is a percentage of patients who can lose weight and then stop taking this medication and then be okay and maintain that weight moving forward. But again, most patients will regain at least some weight once they've stopped the medication. So for the most part, I recommend when we're starting these medications that we think of this medication as a long-term thing that we have you on. But if you want to stop it, we certainly can work with you to try to stop it and make sure that we do it in a way that's safe. All right. Okay, this next topic is my favorite topic, bariatric surgery. Bariatric surgery is going to be your most effective means of weight loss. On average, bariatric surgery is going to give you 25 to 35% weight loss. Again, that's kind of on average. And what I think is so critically important to know is that bariatric surgery, it is not just a weight loss surgery. It's not just about losing weight. It's about so much more because it addresses a lot of the health problems that are associated with being overweight. Things like diabetes, high blood pressure, sleep apnea, high cholesterol. These are all things that are going to improve at the very least and potentially even be cured with bariatric surgery. And I think that is one of the most amazing things that we see with bariatric surgery is the major health improvements that we see long term. So who qualifies for bariatric surgery? This is a little bit of a tricky question, and I think at the end of the day, if this is something that you're interested in, you should talk to your healthcare provider about it. The medical guidelines, so what this means is that as a society of bariatric medical providers, what we think is that if you fit into one of these categories, bariatric surgery is very likely to benefit you from a health perspective. And so what these guidelines are is that if you have a BMI of greater than 35, or if you have a BMI of greater than 30 with a disease that's related to being overweight, then again, very likely you will benefit from bariatric surgery. And so again, if you fit into one of these categories, I think it is worth having a discussion with a healthcare provider about whether or not bariatric surgery is right for you. The insurance guidelines, this is something to just maybe broadly be aware of. This is kind of where insurance companies will generally start covering bariatric surgery. They haven't quite caught on to medical guidelines, and so their BMI thresholds are a little bit higher. And so generally insurances start covering bariatric surgery if your BMI is greater than 40, or if you have a BMI of greater than 35 with a disease related to being overweight. Hopefully, these insurance guidelines will at some point catch up to medical guidelines. All right, so let's talk a little bit about actually what is bariatric surgery. So bariatric surgery, right now, how we do bariatric surgery is we do it laparoscopically, or we do it minimally invasively. Here at Aviva, we do everything laparoscopically. And what that means is that we are making multiple small incisions over your abdomen, and we do the entire surgery through these small incisions. On average, these are incisions that are about 1 centimeter in size. This is in contrast to how we used to do bariatric surgery, which is with a big incision that would extend from your chest bone down to your belly button, and people would have these really big incisions. As you can imagine, these littler incisions have really improved both the recovery and the complication rate long term with bariatric surgery. There are two major bariatric surgeries that are offered and that we do at Aviva. The first is going to be the sleeve gastrectomy. This is the most popular surgery that's performed in the US today. And what we're doing is we're taking out 80% of your stomach and we're leaving you with a thin banana-shaped stomach. And that limits how much food can go into your stomach at one time. The other procedure that we offer is the gastric bypass. With the gastric bypass, what we're doing is we're turning your stomach actually into a very small pouch. This picture is super small, but we turn your stomach into a small pouch, and then we bypass most of your stomach and the first portion of your small intestine, and then we bring up that other end of the intestine and connect it to that stomach pouch. And what we're doing with the gastric bypass is, one, your stomach is turned into a small, almost egg-sized pouch, and it limits how much food can go into your stomach at one time, similar to the sleeve. But the other way that the gastric bypass works is that by bypassing all of that small intestine, we're also limiting how much food, how much nutrients, how many calories are being absorbed through that small intestine. And so it's working through two different ways. Now, when I have discussions with my patients about choosing a bariatric surgery, we will talk about kind of your medical history, and there are certain things in your medical history where I might push you more towards the gastric bypass or more towards the sleeve. And that will end up being kind of a personalized discussion with each of my patients. But I would say that most patients that I see, the sleeve and the gastric bypass are actually very good options for most people. And so ultimately it comes down to personal preference. And again, during our consult, we often will talk about what the pros and cons are with the sleeve, what the pros and cons are with the gastric bypass, and then we kind of come to a decision together in terms of what is best for you. All right. And then I also want to bring up the endo sleeve. This is a newer procedure that we offer here at Aviva as well. And strictly speaking, the endo sleeve, or the endoscopic sleeve gastroplasty, or ESG for short, it's not a surgery, it is a procedure. And what we're doing with the endo sleeve is we go in with a camera through the mouth, into the esophagus, and then into the stomach. And this camera is actually, we have a device attached to it that allows us to go into your stomach and actually put in sutures internally into the stomach. And as we're doing that, that is scrunching your stomach down and decreasing the inside of your stomach so that the inside of your stomach looks similar to that thin banana-shaped sleeve gastrectomy that we talked about earlier. But we're not actually removing any of the stomach tissue. And so as you can imagine, there are no incisions with this surgery, and so recovery is going to be a little bit faster than compared to some of the laparoscopic options that we talked about earlier. The endo sleeve is going to be a little bit less effective as well, though. And so weight loss typically that we see with the endo sleeve is going to be about 20 to 25%. And so this is certainly an awesome option for a lot of people as well. And so this is something that we would talk about during your consult too. Really quickly, I want to address two very common bariatric surgery myths that I think are important to address because I hear about them all the time. And the first is that bariatric surgery is very extreme. And I understand where this comes from. Bariatric surgery, it is surgery. We are making incisions. We're putting you asleep. It's a surgery. But what I want to say is that bariatric surgery is extremely safe. It is one of the safest surgeries that we do today. I have a general surgery background, and so when you go to a hospital on any given day and you look at all of the different surgeries that have been done or are being done during that day, bariatric surgery is going to be one of the safest surgeries that is being done that day. It is on the same level as a gallbladder surgery or a knee replacement, which again are very common safe surgeries that are done every single day. And broadly speaking, the way to think about bariatric surgery is yes, you are accepting some risk initially with surgery, but longer term, you are saving yourself from a lot of different comorbidities, health problems, worsening of health issues in the long run. And so overall, it is going to make you healthier and better. Again, but just accepting some of those small complications potentially at the beginning in the forefront of surgery. All right. Okay. And then the other myth that I hear oftentimes is that bariatric surgery is the easy way out. And in some ways, this is true, right? Bariatric surgery does make weight loss easier. What it is not is it's not a magic wand. It's not a magic bullet, right? You're not just going to lose weight and keep it off with no effort whatsoever. Bariatric surgery is a tool. The point of a tool is it makes something easier for you to do, but you still have to use that tool correctly, and you still have to put work in order for it to be effective long term. All right, here's a summary of everything that we talked about. And then briefly, I want to mention what is Aviva. So Aviva is the weight management group that I am a part of. And we are physically located in Shoreline, Washington, which is just a little bit north of Seattle. And so if you were to have surgery with us, you would have to come down to Shoreline and see us in person so that we can do your surgery. But what's important to know is that for all your other visits, we do offer telehealth, meaning that we could do all of your visits virtually. I love seeing my patients in person whenever they can come in, but I also understand how incredibly hard it is for everyone in their busy lives to have to come to see us physically. So telehealth is a very popular option with a lot of our patients. And more important than what is Aviva or where is Aviva is who is Aviva. Who are the people who you are going to meet when you come to see us? And to some degree, what's important is your surgery group. Who is your surgeon? Who's taking care of you on the day of surgery? That, of course, is very, very important. But I think what is even more important than that is everyone else who is taking care of you, either in the run-up to surgery and even more importantly, who's taking care of you after surgery. Like I said before, surgery or even medications, these are all tools. And as with any tool, you have to know how to use it effectively. You have to know how to maintain it. And if you don't have a team who is there to support you and help you and teach you how to use that tool, it is not going to be the most effective tool for you. And so we have an amazing team and we put so much emphasis in our aftercare for our patients. And I think that really is why our patients are so successful. And so I really want to emphasize again, our team is amazing and we take very good care of you before surgery, during surgery, and after surgery as well. All right, so how do you schedule an appointment with us? You go to our website, avivamd.com. You click on the Contact Us button and fill out the form, and then we'll get a hold of you and get you set up for a visit. And I think that is the talk today. Let me see what questions we might have. Right. Will I lose my hair with surgery? That's a great question. And it's a question that I hear oftentimes. And unfortunately, with bariatric surgery, there does come a lot of positive physical change, but not all the changes are necessarily positive. And one of the things that can be very stressful and not fun for patients is hair loss. It's fairly common. About 50% of patients who have bariatric surgery will experience some degree of hair loss afterwards. But what you have to know about the hair loss is that it is temporary. Bariatric surgery, a lot of different types of surgeries, they are major stresses to your body. And sometimes with major stresses to your body, it actually switches the growth phases of your hair, and it actually pushes your hair to the non-growth phase. And so what patients often find is a few months after surgery, they will lose a lot of their hair quickly. But what you need to know is that your hair follicles are still healthy and that your hair will grow back. But as you can imagine, since you're starting out from zero, it does take a long time for that hair to regrow fully. Um, and so, yes, it's kind of one of the painful things that we'll often see with bariatric surgery. But we need to know is that it is not a permanent change, and that again, your hair will grow back. It just does take quite a bit of time for that to happen. And then if you do find that you have hair loss that is long term, like over a year, that you still have issues with hair loss, then at that point, that's when we would have a discussion and figure out if there's something else going on. All right. Okay. Let's see if there's anything else. Is there anything I can't eat after bariatric surgery? That's a great question. And again, this is a super common question that I have from patients. There is a very specific diet that we ask you to follow directly after bariatric surgery. So, in the first month after bariatric surgery, we will tell you day by day what are the things that you can and cannot eat. And just generally speaking, we kind of go from a liquid diet for about a week, and then we go to like a pureed baby food type diet, and then we go to a soft diet, and then we finally advance you to a regular diet. And the reason that we do that is really we want to protect your healing sleeve and make sure that things are healing completely before we have you eating regular food. That said, after that first kind of month where we're advancing your diet slowly, I tell my patients that there is nothing that is 100% off limits after bariatric surgery. But as you can imagine, there are foods that you want to limit in terms of how much that you're eating, but nothing is 100% off limits. There are certain foods that patients might not tolerate after surgery. It's not uncommon that patients tell me that they can't really tolerate dairy anymore. Some people have longer term difficulty tolerating kind of tougher meats like steak. Some patients also have specific things like starches that they have trouble with. And so there are some things that might change after bariatric surgery, but again, there's nothing that is 100% off limits. All right. All right. I think that is all the questions that we have tonight. Thank you to everyone who's tuned in. If there are any questions that come up, this video is going to be put on our YouTube. So if there's any other questions that come up for someone who's not watching this live, feel free to put them in the comments below and we will get back to you with an answer. All right. Take care, everyone. Goodbye.